I want to dig a little deeper today in the difference between regenerative treatment options and traditional treatment options, and both certainly have value. But what I want to do here as a family nurse practitioner and regenerative therapy specialist is give you a little bit of information so you can make the right choice for you if that's you and if the time comes, when the time comes for that. Many times people get told when they have arthritis or a torn labrum or torn ligaments that really surgery is the only option if they have failed, steroid injections and physical therapy. And that's a scary thought, to have to go under the knife and anesthesia and the recovery from that, often resulting in 6 or more weeks of disability, depending on what you do for work. For me, if I had had my torn labrum repaired surgically, that would have been at least 6 and maybe even 12 weeks of the inability to carry my equipment bag, to go see patients, to do IVs, which is lost revenue, among other many things that parenting wise too, I would have lost a lot of productivity. So for me, and I understand for so many of our patients, that is a thought that crosses our mind, and that should. We don't want to just jump to surgery if there are other options. So I'm going to tell you a little bit about the comparison between regenerative options and traditional, maybe surgical treatment options. Let's take the example of a torn labrum in a shoulder, and that just happens to be very close to me because that is what happened to me, and I chose to avoid surgery successfully in favor of doing regenerative or Wharton's jelly injection treatment. Just one. So I'll tell you a little bit about, in my case, what happened, and I'll give you my case as an example because it mirrors so closely many other, especially orthopedic type cases. So I had pain in really both shoulders, but the left one was the worst. Went to the orthopedist who recommended physical therapy and did a steroid injection into their physical therapy. Did not help. I did it consistently for about 6 months, and it really only got worse. And the steroid injection really didn't help symptomatically or even functionally at all. So I went back to the orthopedist after having failed those treatments, and the option that I was given was surgery, a labral repair. And that would have involved surgery, anesthesia, being cut open, and then also weeks and weeks and weeks of me not being able to do my job, either as a nurse practitioner or really as a mom and as a wife and as a household manager either. And so that required me to think quite a bit before I decided I really can't do that in my life, and I really don't want to take that risk if it's not necessary, of the surgery, of the anesthesia. And there's no guarantee that the surgery was going to be a fix either structurally or functionally or pain-wise for me. So all those things together led me to, and this was a few years ago now, look into stem cell therapy, regenerative therapy, one injection as a way to be able to avoid surgery and get rid of my pain and restore function. In my case, and in so many of the cases that I've seen and that I've heard about, I read about this stuff all the time, it worked. And it didn't work immediately. I had some pain relief immediately. I had some improved function immediately, but over the course of about 6 to 8 months, that's when I really saw all of those benefits. And at this point, I'm 90+% better. And again, that reflects closely what I see in clinical practice and what I hear from others in the field doing this as well. So let's talk about what the options are if regenerative treatments did not exist. We already talked about surgery. If you're in pain, then pain medications become something that can be an option for treatment. Then we have to ask, do we want to be on opioids? Do we want to be on NSAIDs, aspirin or ibuprofen or naproxen every day, most days to manage pain? What are you missing out on in life because you're in pain or you can't function? You can't reach back in the car to hand your kid their book back, right, that they dropped. What are you missing out on in life? And so that's another reason why regenerative treatment is so wonderful, because you can get your function back, you can get your pain decreased without having to take any long-term medications. We have to remember too that medications are not a solution. They are not a treatment. They are a band-aid, and they can help mask the pain, so maybe you can get through your day, but they do not offer any healing. Steroid injections do not offer healing. They offer symptom relief. So to be on those and to use those treatments, there is an appropriate place for those. And as a functional medicine specialist as well, I always want to look for ways to heal and restore and repair the body so that it can function again on its own without outside help or medications. One of the therapies that I love using is what is often referred to as stem cell therapy. Now, these products usually come from either Wharton's jelly umbilical cord from live-born babies or from amniotic fluid from live-born C-section babies. And these are wonderful tissues to be able to use because they are full of cells, fresh, new cells that are ready to get in your body and do their thing, signaling for repair and regeneration and inflammation support and immune support and kind of modulation. So these are such good tissues to use. There is no chance of rejection or reaction, immune reaction to these because they're what's called immune privileged. And what that means is that our bodies do not react to those, just as the mother's body, the mother who's carrying this baby inside of her, the mother's body does not create an immune reaction against the baby, thank God. So these are immune privileged tissues. Now, what's in the Wharton's jelly injection or the amniotic fluid injection, those cells do not actually themselves divide and turn into your own tissue. That's a common misconception. What actually happens is these fluids, these cells get into your body and start signaling. These are medicinal signaling cells, MSCs, used to be called mesenchymal signaling cells or mesenchymal stem cells. So medicinal signaling cells. And these cells get in your body, get in your joint, wherever they're injected, and they start signaling, hey body, we need repair. Hey body, create more stem cells, bring them to the elbow where we need a lot of this repair. And then your own body regenerates and repairs the tissue in an environment where the immunity and the immune reaction and the inflammation reaction is perfected for healing. Another regenerative option that we can use is called PRP, or platelet-rich plasma. This involves just taking 1 or 2, sometimes 3 or 4 little tubes of blood, spinning it down in a very specialized way, and extracting that platelet-rich plasma and injecting it back into a joint or a tissue. A little bit different than stem cells. These actually create inflammation because inflammation for a short period of time can actually promote healing. This is a little bit less powerful, especially as we age. Younger people, PRP tends to be much more effective versus as we get older, we may need to use either a combination of PRP and the stem cell Wharton's jelly injections or even just the Wharton's jelly injections. But PRP is an option and works really, really great in younger athletes or younger people in general. And then peptide therapy and even ozone therapy. We can do peptides either subcutaneously or into the joint or into the affected tissue. We can do the same with ozone, a gas, O3 gas, which is highly, highly healing and regenerative. Depending on what's going on, we would choose an appropriate peptide and an appropriate injection technique, location, and length, duration of treatment. Sometimes it's one and done. Very often with these regenerative treatments, we expect one injection. Sometimes it's a series of 3 or 4, depending on what's going on. But peptides like BPC, for example, if you've heard about peptides, you've probably heard about BPC, is very regenerative. It's a peptide that naturally occurs in our own bodies, which I, of course, love. And it causes the body, again, to signal for regeneration and repair and decreased healing. Oftentimes, we can use these peptides in conjunction with the stem cell therapy. This is actually what I just did yesterday with an Achilles or calcaneal tendonitis caused by some bone spurs. We injected all around there, and results were great immediately. And then we anticipate, healing over the next months. As you might imagine, the risks with surgery are great. There's the anesthesia risk, the infection risk of getting cut open, the risk of making it worse with surgery, the risk of it going wrong in some other way. Surgeries are not without risk, certainly, and I'm thankful they exist and they're not appropriate in all cases. My attitude is if you can avoid the surgery, let's try and do that. If you need it ultimately and we've done everything we can before that, then maybe that is the best choice. But for me personally and for the patients who I care for, I would much rather offer them a less invasive, less risky option first. And that option often is the stem cell therapy with the Wharton's jelly or amniotic fluid or even peptides, PRP, or a combination of all of those. Those are much, much, much lower risk. In fact, lots of the studies show that there's really zero risk to these stem cells. There have never been any deaths as a result of these stem cell or Wharton's jelly injections. It's just very, very safe. The beauty of seeing patients for long visits and really doing thorough assessments is that we individualize treatment plans. So there's not just one treatment that says everybody's getting Wharton's jelly injections in their knees. It's, what's going on? What is their budget? What is the desired outcome? How old are they? What is their lifestyle like? Can we adjust the lifestyle? Have them quit smoking, quit drinking alcohol, limit sugars, limit seed oils, limit processed foods. That's really going to get the best possible outcomes from any of these treatments. And I want the best outcomes for my patients. So I want them to do well. Now, am I going to guilt and shame people into quit eating sugar or quit drinking alcohol? No, but I am going to inform them that they will get better results if they can do the best they can at following those lifestyle recommendations. So if you are struggling with joint pain or arthritis or a torn labrum like I was, I would encourage you to look into regenerative medicine before you jump straight to surgery if that's what's recommended. Your orthopedist is a surgeon and they have real skills and knowledge and expertise there. That may not be the skill, knowledge, or expertise that you need for this. I love my orthopedist as well, and I'm super glad that I looked into stem cells for my shoulder to avoid having him need to cut me open and fix my labrum. I think it is functioning wonderfully and very little pain, if at all, most days. So look into that for yourself. Be sure about the treatment option that you're choosing, and then find somebody who you can trust. If you choose to go with these injections, we're in Illinois, and so we're of course more than happy to see you. But clinics are, I don't want to say popping up, but there are options around the country and world now. So find somebody you trust, ask them questions. We offer a free 15-minute discovery call, so I can ask you questions, you can ask us questions, and figure out if this treatment is best for you. We want to pick patients who are going to benefit from this. You can book a free discovery call on our website, nourishhousecalls.com. I look forward to speaking with you.